Yo, what up? It's a tip of the week, and today we're going to discuss how you should study as a DS1.
If you love this tip and want to go deeper, check out this course. I can describe this course in one simple phrase: surgical coaching in your office. Concierge Surgical Coaching is a PACE accredited with the Academy of General Dentistry. This course offers an innovative approach to surgical and implant dentistry that can help you achieve your goals. Concierge Surgical Coaching gives you affordable prices, hands-on training, how to handle complications, step-by-step methods for best results, and how to discuss patient finances and your return on investment. Gain the skills you can use now on your patients for tomorrow that could achieve your production, clinical goals while never booking a flight for education again. Start earning CE today. Enroll at jaredwdds.com.
Come on, guys. Dental student year one. Stick with me. All right. So the first thing that you have to do is be willing to fail. Stick with me. You got to be willing to fail. If you're not willing to fail, what you're probably going to do is stay within your comfort zone. No, since you're in dental school, you've done a significant amount of work. You've gotten letters of recommendation. You've done community services. You've taken a whole bunch of tests, and you have a significant amount of money that you're going to have to pay back to your creditors when you either matriculate or you don't. So it is very important that you hear what I'm telling you or my suggestions that I'm giving you so that you are successful. So be willing to fail. What does that mean? It's like removing your pride. You have to remove all pride because dental school is only 4 years. All right, 4 years. Now you can make it longer depending on the school you go to and how lenient they are. But dental school is 4 years, and during that time frame, drop all pride and be willing to go and get as much information as you possibly can so that you, your family, and all your friends could be happy that you finished when you said you were going to finish. Also, by being willing to fail, you're going to do everything in your power to remove ignorance. Guys, there's nothing wrong with being ignorant because it's just simply not knowing. But to stay ignorant, that's your problem. And by being willing to fail, what you're literally doing is leaving no stone unturned in order for you to be successful. And that's how you're basically going to be successful as you matriculate dental school and through these courses that start at the first year. Number two is this: you got to figure out what type of learning style you have. I'm going to go to my list here so that I don't mess it up. So the first one is this: visual. Do you have to see things in order for you to grasp it? Auditory. Do you need to hear things in order to grasp? Verbal. Do you need to just get it out of your system that way? Physical. Touch it. Just manipulate what's going on. And last but not least is the reasoning, the logic side of it. Going over questions and problems to make sure that you kind of reason what's actually going on here. One thing that I would highly recommend is also don't stop there. And this is my third point, and that is, do you need to be in a group when there's like 5 or 6 people around or 3 or 4 people around and y'all just going back and forth? Or do you need to be in a room by yourself? See, this is something that I had challenges with when I was in your same position. I remember my second semester, my first year, I was getting hammered by courses such as gross anatomy, biochemistry, and it was killing me. And I would see my classmates reading books like Netters and BRS and all these review books. And I'd see some students going over lectures, some doing notes, some were reading. And I was like, oh my gosh. And then a light bulb went off. Well, no, it didn't. I just stumbled upon it. Nobody really helped me along this process. I just realized that once I read a book, like the actual book, not a review course book, I was able to grasp it so much quicker. And then I remember I used to go deal with a bunch of these groups, and some people would drag our sessions on forever. And I was like, man, I have ADD to the max. And so people talking and carrying on, it's just like, dude, you need to sit down and relax. I got something I got to do. Like, I was serious. And so I was just like, you know what? Let me read it. Let me go in my room, close the door, lock it, turn the fan on, and just read until I have to read a sentence twice. And for me, that was my successful point. And ever since I've done that, I have not changed that routine, and I've been able to just get exactly where I wanted to go in what I perceive to be success. And so as a D1 or as a dental student, second year, third year, fourth year, even resident for that matter, or even doctors who've even graduated, like, figure out what works for you. Don't be tied to one particular thing. Be willing to fail. Like, shut out everybody so that you can be successful, guys. And once again, this channel, I will never tell you anything that I haven't personally done myself at least a year or more. And so I want to make sure that anything that I say on this channel is something that I've done and had success with. And if you apply it, I look forward to hearing your success. So guys, it was an honor and a privilege to share with you. So what I want you to do is this: write down in the comments below, what are some of the tactics that you use? What are some tactics that you've found to be successful for you? Because this channel is simply to help you guys understand that what looks hard is often easy. So once again, guys, I'm Dr. Jared Williams, and my focus is for you to smile after surgery. Make it a great one.